Have you ever noticed that some changes in your body just don't seem to go away, no matter how much you try to ignore them? Maybe it's a little discomfort in the lower abdomen, or something as simple as a slight change in your bathroom habits that's been nagging at you. It's easy to brush these things off after all. We're all getting older, right? But what if I told you that these seemingly small changes could be early signs of something that requires your attention? Today, I want to talk to you about a subject that's important for every man to understand, especially as we get older: prostate cancer. Now, I know this topic may feel a little uncomfortable or even daunting, but it's critical to have the knowledge so that we can take action when necessary. You see, prostate cancer is one of the most common cancers affecting men, particularly after the age of 50. It's something that can grow quietly, without any major symptoms in the early stages, which is why it's often called a silent cancer. But here's the thing: early detection can make all the difference. If caught early, treatment can be much more effective, and the chances of a full recovery increase significantly. In this video, we're going to break down the subtle signs of prostate cancer that you should never ignore. We'll also discuss the important role that regular checkups play in maintaining your health. As we dive into these early warning signs, I want you to keep in mind that it's not about panicking, it's about staying informed and proactive. So, let's start by talking about one of the first changes many men experience: urinary issues. It's not uncommon for men over 50 to notice some changes when it comes to bathroom habits. But here's the thing: if it's something new or different, you shouldn't just brush it off. Changes in your urinary flow can often be the first sign of prostate problems, including prostate cancer. Now, you may be wondering what kind of changes to look out for. Well, one of the most common signs is difficulty starting urination. Have you ever found yourself standing there, waiting for things to get going, but it just doesn't seem to happen? Or maybe your urine stream feels weaker than it used to, and you have to push a little harder. These could be early warning signs that your prostate is enlarged or possibly dealing with abnormal growth. While it's easy to think of this as just a part of getting older, it's actually one of the first symptoms that could point to prostate cancer. Another sign to keep an eye on is frequent urination, especially at night. I know it's common for people to wake up once or twice during the night, but if you're suddenly waking up multiple times throughout the night to use the bathroom, that's worth paying attention to. This condition is called nocturia, and it happens when the prostate grows and puts pressure on the bladder. An enlarged prostate can create an urge to urinate more often, interrupting your sleep and leading to feelings of fatigue during the day. But here's the kicker: if you're experiencing these symptoms, it doesn't automatically mean cancer. It could be something much less severe, like an infection or benign prostate enlargement, which is common as men age. But that's exactly why it's so important to take any changes in your urinary habits seriously. Early detection is key. If you've been noticing any changes, I encourage you to consult with your doctor so you can get to the bottom of it. The second sign to be aware of is the presence of blood in your urine or semen. This is one of those symptoms that can really make you sit up and take notice. It's alarming to see blood in your urine, hematuria, or in your semen, hemispermia, and understandably, you might panic. But it's crucial not to ignore it. Yes, blood in these fluids can be caused by a range of different issues, from infections to kidney stones. But when it's connected to the prostate, it could signal the presence of abnormal cells or a tumor. Now, don't jump to conclusions right away, but definitely don't ignore it. If you notice blood in your urine or semen, it's essential that you seek medical attention. Your doctor will likely perform a series of tests, everything from blood work to imaging, and sometimes even a biopsy to figure out what's going on. Early intervention can be a game changer, so make sure you don't delay seeking advice. Let's take a moment to acknowledge how difficult it can be to talk about these things. For many men, even bringing up these issues with a doctor can feel uncomfortable or embarrassing. But here's the truth: your health is the most important thing. The earlier you catch a problem, the easier it is to treat. And that's why it's so important to push past any discomfort and have these open conversations with your healthcare provider. After all, we're talking about your well-being, and that's something worth prioritizing. Now that we've covered the first couple of early signs: urinary changes and blood in your urine or semen, let's move on to another common symptom that many people tend to ignore: pelvic pain. You might be thinking, pain in the pelvic area. That sounds like something I'd definitely notice. And you're right, it is something that usually stands out. But the thing is, many men mistakenly attribute pelvic discomfort to something like muscle strain or just aging. But persistent or sharp pain in the lower abdomen, lower back, or even the genital area could be an indication that something is going on with your prostate. If the pain is constant or becomes more noticeable over time, it's definitely something to address. Often, this kind of pain can signal that a tumor is growing, which can be putting pressure on surrounding organs and nerves. In the later stages of prostate cancer, this pain can become severe and debilitating. So, don't wait until it becomes unbearable. Pay attention to your body and seek medical advice early on. And remember, it's not just about the pain. If you start feeling like your body isn't functioning the way it should, whether it's because of fatigue, pain, or other discomforts, trust your instincts and get checked out. Prostate cancer might not make itself known with flashy, obvious symptoms, but paying attention to the subtle changes can make all the difference. I want to leave you with this: listening to your body is one of the best ways to stay ahead of potential health problems. Whether it's a change in your urination habits, unexplained pain, or blood in your urine, never feel embarrassed to bring these things up with your doctor. Taking action early gives you the best chance for successful treatment and a healthier future. Next time, we'll dive deeper into some more subtle signs that could indicate prostate cancer, and we'll talk about how taking preventive measures can help protect your health as you age. Stay tuned, and remember, you've got this. Now that we've touched on some of the early signs of prostate cancer, like changes in urination, blood in your urine or semen, and pelvic pain, let's move forward and explore a few more subtle symptoms that could indicate something's not quite right. It's important to remember that none of these symptoms automatically mean cancer, but they are definitely worth taking seriously. As we continue, I want you to keep in mind the importance of early detection and the steps you can take to stay proactive about your health. One of the symptoms that many men notice, especially as they get older, is changes in sexual function. Now, this isn't an easy topic to bring up, but it's one that plays a big role in men's overall health. If you've been experiencing difficulty maintaining an erection or a decrease in sexual desire, you should definitely pay attention. It's easy to attribute these changes to stress, aging, or other factors, but they can also be related to prostate health. As the prostate enlarges or develops cancer, it can put pressure on nearby nerves and blood vessels that control sexual function. This can lead to erectile dysfunction, which is the inability to achieve or maintain an erection. While ED can certainly be caused by other health issues like diabetes, high blood pressure, or stress, if it's a new symptom or it's progressively getting worse, it's something you should discuss with your doctor. Additionally, some men notice a decrease in semen volume or experience pain during ejaculation. This could also be linked to changes in the prostate or the ducts responsible for transporting sperm. While some men might dismiss these issues as just part of aging, they're actually red flags that should be addressed early on. The sooner you talk to your doctor, the sooner you can get a clear picture of what might be happening. You might be wondering, is this just a normal part of growing older? And while some changes in sexual function are indeed part of aging, these symptoms could also be linked to prostate cancer. The key here is that if you notice changes that are unusual for you or that seem to be getting worse, don't ignore them. Talk to your healthcare provider so they can perform tests and determine what's going on. Let's shift gears for a moment and talk about another symptom that's often overlooked: unexplained weight loss. Now, we all know that it's normal for our metabolism to slow down as we age, but sudden and unexplained weight loss can be a sign that something more serious is at play. If you've noticed that your clothes are suddenly feeling looser, or that you're losing weight without trying, it's definitely something worth paying attention to. In the case of prostate cancer, weight loss can happen because the tumor is using up energy that your body needs to maintain normal function. Tumors can also affect your appetite, making you feel less hungry and causing you to lose weight without consciously trying. If weight loss is accompanied by other symptoms, like fatigue, pale skin, or loss of muscle mass, it's crucial to get checked out by a doctor as soon as possible. The sooner you catch any changes in your body, the sooner you can address them, potentially preventing more serious complications down the line. Speaking of fatigue, let's talk about another symptom that often goes hand in hand with weight loss: persistent tiredness. We all experience fatigue from time to time, especially after a busy day or during stressful periods. But when you're feeling tired all the time, no matter how much rest you get, that's when it becomes a concern. If you're constantly drained, even after a full night's sleep, it could be a sign that your body is fighting something, and prostate cancer is one of the possibilities. Tumors, including those in the prostate, require a lot of energy from your body to grow and spread. This can take a toll on your overall energy levels, leading to that persistent feeling of tiredness. If you're finding it harder to stay active or engage in your usual hobbies, it might be time to have a conversation with your doctor. Don't let fatigue become a part of your everyday routine. Address it early on, and you'll have a better chance of managing it and whatever might be causing it. Another symptom that many men tend to overlook is a persistent feeling of pressure in the bladder. It's that nagging sensation that your bladder is never quite empty, even after you've just gone to the bathroom. This feeling of bladder pressure often occurs when the prostate becomes enlarged. An enlarged prostate can press against the bladder, making it feel as though you still need to go to the bathroom, even after you've emptied your bladder. It's an uncomfortable symptom, and one that can be really frustrating if it's interfering with your daily life. But like many of the other symptoms we've discussed, this is something that could be linked to prostate cancer, especially if it's getting worse or causing you pain. Left untreated, this pressure can lead to more serious complications, like urinary tract infections or even kidney damage. So, if this is something you've been experiencing, don't wait to seek help. A quick visit to your doctor can provide clarity on whether this is a benign issue or something more serious. Now that we've covered a few more symptoms, I want to take a moment to emphasize the importance of regular checkups. I know it can be easy to put off doctor visits, especially if you feel fine or if your symptoms seem minor. But here's the thing: prostate cancer doesn't always make itself known through big, noticeable symptoms. Many of the early signs can be subtle, and by the time you start feeling worse, the cancer might have progressed further than you'd like. That's why routine screenings are crucial. Getting checked regularly, even if you feel fine, is one of the best ways to stay ahead of any potential health issues. I'm not just talking about a physical exam. Things like the PSA prostate-specific antigen test and the digital rectal exam are key tools that doctors use to check for prostate cancer early. These tests are simple and relatively quick, but they can be life-saving. If you're over 50 or even younger, if you have a family history of prostate cancer, it's really important to get these screenings done on a regular basis. Now, I know some of you might be thinking, I don't know if I can go through with a rectal exam, or you're worried about the discomfort. I get it, many men feel that way. But here's the thing, your health is worth it. The minor discomfort of a quick exam is nothing compared to the benefit of early detection. By getting these exams, you're taking control of your health and setting yourself up for a future of better outcomes. The most important takeaway from this video is that you don't have to wait for the big signs to act. If you notice any of these symptoms, whether it's changes in urination, persistent pelvic pain, unexplained weight loss, or trouble maintaining an erection, take the time to talk to your doctor. You don't have to wait for things to get worse. Early action is always the best course of action. In our next video, we'll dive deeper into preventive measures that you can take to protect your prostate health, as well as discuss treatment options if prostate cancer is diagnosed. Don't go anywhere, and remember, staying informed and proactive is your best defense. Now that we've discussed several important early symptoms to watch out for, like changes in urination, pelvic pain, erectile dysfunction, weight loss, and fatigue, I want to finish off by talking about a couple more signs that could indicate prostate cancer, as well as the proactive steps you can take to protect your health moving forward. One symptom that you may not immediately associate with prostate cancer is a sudden change in your bowel habits. You might notice that you're having more frequent bowel movements, or perhaps you're dealing with diarrhea or constipation that's different from what you've experienced in the past. These symptoms are often linked to an enlarged prostate pressing against the rectum, which can disrupt normal bowel function. In some cases, this could even be a sign of a tumor that's affecting nearby tissues. While bowel changes can happen for all kinds of reasons, including diet and stress, it's important to take note of any new or persistent changes. If your bowel habits are consistently different from what they usually are, or if you're also experiencing other symptoms we've covered in this video, it's time to speak to your doctor. They'll be able to conduct tests to determine whether your symptoms are related to prostate health or something else. Along with these symptoms, you might notice a decrease in your overall physical performance. As prostate cancer progresses, it can cause a general sense of weakness or a decline in strength, even in your everyday activities. This can sometimes be mistaken for normal aging, but if you're feeling a lot weaker than usual, or if it's interfering with your ability to do the things you love, you should let your doctor know. It could be a sign that your body is struggling with something more serious, and early treatment can make all the difference in maintaining your quality of life. As we continue to age, it's not uncommon to experience a few physical changes. But the key to staying healthy is listening to our bodies and recognizing when something's different, especially if these changes are persistent or worsening. Don't let the fear of a diagnosis keep you from seeking medical advice. Remember, knowledge is power. The more proactive you are, the more empowered you'll be in making decisions about your health and treatment. Now, let's talk about the steps you can take to reduce your risk of prostate cancer, or catch it early if it does develop. As I've mentioned before, early detection is the most powerful weapon we have against this disease. One of the best ways to stay ahead of prostate cancer is by scheduling regular screenings. These simple tests, like the PSA prostate-specific antigen test and the digital rectal exam, are key to identifying any abnormalities in the prostate. You don't need to wait for symptoms to show up before seeing your doctor. If you're over 50, or if you have a family history of prostate cancer, it's a good idea to get checked regularly. It's also important to talk to your doctor about your risk factors, as prostate cancer can affect men differently depending on age, family history, and ethnicity. Understanding your personal risk can help you make more informed decisions about when and how often to get screened. But even if you're at average risk, these routine checkups are an essential part of staying healthy as you age. Along with regular screenings, there are lifestyle changes you can make that may reduce your risk of prostate cancer. Maintaining a healthy diet and staying active are two of the most important steps you can take. A diet that's rich in fruits, vegetables, whole grains, and lean proteins can help keep your body in top condition and reduce the risk of cancer. Avoiding processed foods, excessive red meat, and unhealthy fats is also crucial in maintaining prostate health. Regular physical activity is another key component in staying active. Helps you maintain a healthy weight, improves circulation, and boosts your immune system. Whether it's walking, swimming, or something else you enjoy, keeping your body moving is one of the best ways to reduce your cancer risk. The idea is to find something that works for you and stick with it. Even light activity, when done consistently, has a big impact on your health. Of course, it's not just physical health that matters. Mental health plays a big role in our overall well-being, too. If you're stressed or anxious about your health, that can take a toll on your immune system and overall health. Managing stress through hobbies, relaxation techniques, or talking with a counselor can go a long way in helping you maintain a healthy mind and body. As we wrap up, I want to remind you that prostate cancer is one of those conditions that often doesn't show obvious symptoms until later stages. That's why early detection through regular screenings is so crucial. Even if you're feeling fine and not experiencing any noticeable symptoms, having a yearly checkup could make all the difference in catching any potential issues before they become more serious. It's also important to remember that prostate cancer is not the end of the road. Treatment options are available, and when caught early, the outcomes can be very positive. Whether it's surgery, radiation, hormone therapy, or other options, there's a range of treatments that can be tailored to fit your specific needs. If you do get a prostate cancer diagnosis, remember that you're not alone. Your healthcare team will guide you through the process and help you make the best decisions for your health. In closing, I want to say this. Don't let fear or embarrassment prevent you from seeking help. Whether it's a simple checkup, a conversation with your doctor, or a more in-depth examination, taking care of your health is the most important thing you can do. Stay informed, stay proactive, and trust that you're doing everything you can to stay healthy for years to come. I also want to encourage you to share this video with someone who might benefit from this information. It's never too early or too late to start thinking about prostate health. If you have any experiences or thoughts to share, feel free to leave a comment below. We can all learn from each other and support one another on this journey to better health. And finally, if you haven't already, please like this video and subscribe to the channel for more helpful content about staying healthy as you age. Here's to living your best life at any age. Remember, you've got this.